There are some very serious disorders of the autonomic nervous system. The first one on this slide is what is referred to as autonomic neuropathy, and it's damage to autonomic nerves, and it can result as a common complication of diabetes mellitus. So having extensively high sugar and being diabetic can be a risk factor for damaging these autonomic nerves. So early signs could include sexual dysfunction. Other frequent symptoms could be dizziness, sluggish eye pupil reactions. So this is an example of a normal heart rate, normal sympathetic and parasympathetic working. But if we have dysfunction, there could be resting tachycardia, which we don't want, have someone having a really fast heart rate all the time, or orthostatic hypotension, where a person stands up too quickly and their blood pressure drops. So the control of the autonomic nervous system is mostly under the regulation of the hypothalamus. So that's generally the main integrative center of the autonomic nervous system. So the anterior region directs parasympathetic function, the posterior region directs sympathetic, and it may be direct or indirect through the reticular system or spinal cord. So some of the things that happen in the hypothalamus are control of the heart, blood pressure, body temperature, water balance, endocrine activity, emotional responses like rage, fear, and pleasure, and of course the fight or flight system. However, areas below that would also control the autonomic nervous system as well. It's just that the hypothalamus is kind of the highest level, the boss of the autonomic nervous system. So below the hypothalamus would be the brainstem and the spinal cord, and they can directly change the autonomic nervous system. The medulla, for example, regulates heart rate, blood vessel diameter, because it has what's called the vasomotor center in it. The midbrain can control the muscles of the pupil and the lens. And the spinal cord controls things like defecation and urination, which is called micturition. So in this slide, what we're seeing is something called biofeedback. Biofeedback is utilizing your cerebral cortex to become aware of what the hypothalamus is doing. And it's really interesting. The patient is looking at a computer here, and there are physiological variables on the screen. And the patient is trying to override those physiological variables. So, for example, one is called the galvanic skin response, which is essentially a lie detector test. So the patient is looking at the computer and it's recording the responses of skin receptors, and they're trying to use their cerebral cortex to override it and essentially make themselves relax. So biofeedback involves the awareness of physiological conditions and with the goal of trying to consciously influence them. So it could be useful for controlling migraines, managing stress, and it's all due to the connection of the hypothalamus to the limbic system, which allows for cortical influence. And we see that relationship on this slide. So while it's communication at the subconscious level, in the case of biofeedback, it could be overridden by the cerebral cortex. But normally, the hypothalamus is the boss, the integration center for the autonomic nervous system, and it oversees what the brainstem and the spinal cord do. The brainstem is responsible for pupil size, heart, blood pressure, airflow, salivation, and basic reflexes like defecation, erection, ejaculation are all at the spinal cord. Other disorders of the autonomic nervous system include deficient control of smooth muscle activity. So we know that there's smooth muscle inside of all the blood vessels. You learn next semester that's called tunica media. When that is not working, the blood pressure could get too high. So it could lead to hypertension, and that would be overactive sympathetic vasoconstrictor response to stress. And um, it could occur um, if there's basically an overload of the sympathetic nervous system. There's a condition called, they call it in medicine abbreviated pheo, but what it is the uh, chromocytoma. And basically, what it is a tumor in the adrenal medulla. And because of this tumor, the adrenal medulla is going to be releasing excess amounts of epinephrine and norepinephrine. So it's kind of like it would be the sympathetic nervous system gone wild, gone on overload. So the patient might need certain medications that could block the norepinephrine binding to its receptors. Other disorders of the autonomic nervous system include Raynaud's disease. You may have heard of this. And it can lead to painful, exaggerated vasoconstriction in the fingers and the toes. You can see a patient here that has this with the digits turning pale or cyanotic, and it's treated with vasodilators. Another example is autonomic dysreflexia. And what this is when there's life threatening, uncontrolled activation of autonomic neurons in people with spinal cord injuries, like quadriplegics, or people with injuries above T6. So this is so bad because the blood pressure skyrockets, and there's a really high risk for a stroke. So we can see in this situation that there's a full bladder. That would be one example. It stimulates this. So this dysreflexia can be triggered by all kinds of things, even things like normal movement of the bowels. In this case, the stimulus is that there's a full bladder. The stimulus should go to the sacral spinal cord. There's a massive sympathetic response leading to hypertension. These receptors sense a hypertensive crisis. However, it leads to a stroke, unfortunately. Normally, what should happen is a slowed heart rate and inhibition of that. But that doesn't always happen in autonomic dysreflexia. So the autonomic nervous system, unfortunately, like so many other things, declines in old age. It's partially blocked because of structural changes at the preganglionic axon terminals. And again, remember that they always release acetylcholine. Doesn't matter whether they're parasympathetic or sympathetic. So some of the effects of age on the autonomic nervous system could include constipation, dry eyes, because that's a parasympathetic effect, frequent eye infections, or orthostatic hypotension.